Have you wondered when you look at all of the information out there about exercise, yoga, stretching, walking, everything you should be doing after breast cancer surgery, and you're thinking, yeah, that's great, but where do I start? Simple. Start with a foundation. And I'm going to teach you foundational movements starting today with the first one. Hi, I'm Marian Barnett, cancer movement therapist, and I want to come to you today to talk about the foundational movements that are so important when you are regaining your mobility after breast cancer surgery. Shoulders are key to getting back the mobility after breast cancer surgery. You're not going to think about it because you're going to feel that tightness through the front, but all of the muscles that are pulling the scar tissue and the work that's been done during surgery is going to change not only how the shoulders move, but how tight the skin, the fascia, and the muscles are. This can be after reconstructive surgery as well, and also if you have expanders put in. So all of these are going to change how you move, and to a lesser or bigger extent, it's going to change how the shoulders move. So the one I want to talk about today is shoulder flexion. So this is the movement that's in front of the body. This is the movement that comes from the shoulder and is coming up in front. Not to the sides, not on an angle, but straight in front. Now chances are you're going to combine this with other shoulder movements and other body movements to create what you need for your activities of daily living, for the functions throughout the day, for your activities you love, your sports, taking care of the kids, but the foundation is straight in front. So if we think of things such as driving the car, grabbing your coffee cup, putting on your shoes, doing your hair, taking your shower, getting dressed, all of these have a combination of flexion. So if you have decreased mobility, range of motion, in the shoulder with flexion, you may change how you are completing these tasks. You may say to me, you know what, Marian, I get all those tasks done. Yeah, it may not be normal, it may be a little different than what I used to do, but I get the tasks done. A, fantastic for getting them done, pushing through. You're a badass, you are a trooper. This is great. My point is, if you're happy, fantastic. But if you're noticing limitations with other things you want to do, or you want to do a little better than what you're doing, then I want you to take a look at the straight ahead movement of flexion. We can add it to all the other activities. So when you think about reaching for something, the arm's going forward, and then I'm moving the shoulder, then I'm twisting my body. All of those come into play. But I don't want you to say, my shoulder only goes to here, I can't go past, so I'm going to twist my body and I'm going to lean. Why? Because you're bringing on new problems. You don't need any new problems. You got enough on that journey. So twisting for the upper back or the low back, or reaching with other movements, if those foundations aren't set in place, you're going to be limited with having to use other body parts and potentially risking injury. Now, I'm not telling you this to say, oh my gosh, everything is doomed. I'm telling you this to show you how important it is to lay the foundations. I know that patients use the term new normal, and I understand it from my patient's perspective when they tell me that. But what I want to do is set that foundation for you so that new normal is as close to the activities that you were doing, if not better, after breast cancer surgery. So if you have questions, DM me, send me an email. I would love for you to take a video and say, you know what, Marian, I watched your Monday Moves with Marian. I saw how I was supposed to do the flexion, but I'm not getting it. I think I'm cheating. I might be leaning. My elbow might not be straight. I just can't see it. Can you take a look? Absolutely. That is what I'm here for. That is my goal, is to be of service and help you see how to get to that next step. So send me the video, send me a note, and we'll go through step by step. And as you've seen in the Monday Moves, I dissect those movements. I cut them up and show you exactly what you need to do. That's my secret sauce. That's what I do, is I see all of those little strategies and I'm gonna point them out. Not that you have to fix everything, but you can fix what's most important to you to get you to where you want to be. I truly believe that cancer movement therapy is individualized. It is where you want to be to reach your goals. But there is a step-by-step progression. It has to be this way. Research, science, physiology, biology, our body moves in a certain way. It heals in a certain way. And I want to make sure that you have the foundations to heal and get to the next step in your journey. When that foundation isn't there, it makes it really hard to build up on that. So I want to have you send me the email, send me the video, ask your questions, and let's make sure you're on the right track.